Many know October is Breast Cancer Awareness Month, but a new survey done by Orlando Health suggests that even though women know about breast cancer, an alarming number of young women have no plans of getting a mammogram. So why is that? Julie Broughton is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
About 42,000 women each year die from breast cancer. The best way to prevent that from happening is screening and early detection, so knowing your risk is critical. Joining us now is Dr. Danielle Henry, a breast surgical oncologist with Orlando Health. Thank you so much for being here this morning.
Thank you so much for having me.
Yeah, and one of the most troubling things from a recent survey we found out is that women are skipping mammograms. I know during the pandemic, a lot of people were skipping their regular screenings. Do you think that that's a contributing factor to it?
Absolutely. I think during the pandemic, there was a lot of anxiety of being in a healthcare setting when we didn't know a lot about COVID. But the truth is that the healthcare setting is actually one of the safest places to be. Lots of precautions taken related to COVID and any infectious disease. I think women now are starting to come around and catching up on their screenings, which is really important, and give us the opportunity to detect cancer if it is there.
And what are the guidelines? I feel like they've switched recently, the age guidelines for mammograms. Go over what those guidelines are for anyone sitting at home who may not realize that it's time for them.
Absolutely. So there has been a little bit of controversy of when a woman should start getting their mammograms. All of the major surgical, radiation, and cancer societies recommend that women get a mammogram starting at age 40, and they should get a mammogram each year. Now, there are some women that may be at a higher risk for breast cancer and may need to start a little earlier, and that's why knowing your family history is really important. So for some women, they may need to start earlier than 40. So if they have a genetic disorder like BRCA1 or 2, they would need to start maybe at the age of 25. And then a woman who doesn't have that disorder may need to just start 10 years earlier than their youngest diagnosed family member.
So you mentioned BRCA1 or 2, explain. I think a lot of people think just because they have a family history that maybe that means for sure that they have that. How do you know? Is testing the only way to know?
Absolutely. So testing is the way to know for sure if you have something that was passed along in your family that makes you at a significantly elevated risk for breast cancer. And the two most common genes that we know the most about are BRCA1 and 2. There are some other genes that do make women at an elevated risk for breast cancer, but not as high as BRCA1 and 2. So if you talk to your family, which is really important for knowing what your risk is, you can get tested, and if those tests come back positive, then we would know what we can do. And there are even some things that we can do to help prevent breast cancer, like removing the breast before it even develops.
And last week, Katie Couric announced, that she had been diagnosed with breast cancer in June. And one thing that was interesting that a lot of people were talking about is her breast cancer was not detected on a mammogram. She said she had dense breast tissue, and it was detected on an ultrasound. How do you know if that's an option for you, and does insurance cover that?
Absolutely. So that is definitely very nerve-wracking, and it leads some women to believe that maybe they don't need a mammogram at all. But the surefire way to be able to detect breast cancer early in a lot of circumstances is with mammography. Now, if a woman has dense breasts, they may need to have mammogram in addition to having an ultrasound. Now, we don't know all the details about her diagnosis, but some breast cancers grow very fast. So if you have a negative mammogram, you don't want to say, oh, well, I feel this lump, but my mammogram was negative, it's nothing. Sometimes your cancer can grow from the time that you had a mammogram. So you always want to go back to your doctor and start from scratch with a mammogram and an ultrasound. The ultrasound is great because sometimes it can help us see through the density or what I call cloudiness in the breast. So sometimes they need to be done together.
And what would you say to somebody who is nervous about getting a mammogram or scared of either the procedure or the results? Why would you encourage them that this is something they need to do right now?
So the 5-year survival rate for early breast cancer is in the 90s. So breast cancer is very treatable and very survivable. And the only way that we are able to detect it early is if we go in for our mammograms. And so don't be scared. I know that it's very nerve-wracking, but you definitely want to use the opportunity to detect cancer early so that we can treat it and cure it. And that's definitely what gives me a lot of encouragement in what I do, because I know that I can help a lot of women.
All right. Well, thank you so much for being here with such great information. We appreciate it.
Thank you. Thank you for having me.
All right.